Guys, welcome to a new episode of Dr. Jazz. Today is section 4, but we can't tell that it is a section 4 because I'm not telling you the anatomy section. So today we are discussing about ABG interpretation. ABG means arterial blood gas. So we are discussing the basic information about ABG. It is very important topic in every exam. That it is very easy. Actually, it is very easy, but if you have any doubt, then we will mark a wrong answer in questions because it is a little bit confused one and it's very important and it's easy. If you know the concept, it is easy. So we will discuss the ABG sections, how to understand which is respiratory, which is metabolic, which is acidosis, alkalosis, the ranges, everything I will explain you. So within this section we will understand some basic information. So let's move to ABG interpretation. Chapter is ABG or arterial blood gas interpretations. So let's start the arterial blood gas interpretations. So I will explain you the normal values first. Here the normal values of pH is 7.4 and PCO2 carbon dioxide is 40 mmHg and HCO3 bicarbonate is 24 mmHg. These are the normal values of gas. So CO2 is an acid base and HCO3 is an alkali, or it's a base one. So just remember that CO2 is acid and HCO3 is alkali. We are moving to interrupt the pH level. So if the pH is less than 7.4, the normal is 7.4. So if the pH is less than 7.4, it is acidosis, and the pH is more than 7.4, it is alkalosis. So we will learn about what is respiratory acidosis, metabolic acidosis, and respiratory alkalosis and metabolic alkalosis. The first scenario is if the PCO2 increase more than 40 mmHg. You know that the PCO2 normal value is 40 mmHg. So here PCO2 increase more than 40, maybe 42, 45, 50, 55, 60 like that. PCO2 increase, it's called respiratory acidosis. So PCO2 increase more than 40 mmHg is respiratory acidosis. So if the respiratory acidosis happen in our body, the body will do like a compensating mechanism. Our body will do itself like a compensatory mechanism. Our body will increase the level of HCO3, bicarbonate level will increase in our body. So the kidney will increase the reabsorption of bicarbonate, hence called renal compensation. Again, I'm repeating this same point. Here PCO2 increase called respiratory acidosis happen in our body. So our body itself or the kidney will increase the reabsorption of bicarbonate, hence it called as renal compensation. So moving to next scenario, if in acidosis there is decrease in HCO3, so normal value of HCO3 is 24 mmHg. So here decrease of HCO3 leads, or it's called metabolic acidosis. So what happened or what body will do in metabolic acidosis case, the body will do that will be decrease PCO2 in our body. So our body does the hyperventilation and reduce the carbon dioxide, hence called respiratory compensation. Again, I am repeating, in the case of decreased HCO3 bicarbonate less than 24 mmHg, hence it called metabolic acidosis. In stage of metabolic acidosis, our body does the hyperventilation and reduce the carbon dioxide from the body, hence we can call it is a respiratory compensation mechanism is happening. So we know now what is acidosis, like respiratory acidosis and metabolic acidosis. In respiratory acidosis, the PCO2 level is increased and HCO3 also increase. In metabolic acidosis, HCO3 decrease and PCO2 also decrease. So in respiratory acidosis, renal compensation is happening. In metabolic acidosis, respiratory compensation is happening. So we can move to alkalosis. The first scenario in alkalosis, if the PCO2 is decreased less than 40 mmHg, it's called, or it's hence called, respiratory alkalosis. So in respiratory alkalosis cases, what our body is doing? So body will decrease the HCO3 level to tally this case. So if decrease PCO2 less than 40 mmHg, hence called respiratory alkalosis. The body do that. Body excrete more bicarbonate, causing acidosis to balance the alkalosis, hence called here renal compensation. Again, I'm repeating the same point. It's very important that here our body excrete more bicarbonate or HCO3 from our body to balance, or causing acidosis to balance the alkalosis. That's why we are calling here renal compensation. Hope you all understand this point. Then we are moving to next scenario. If in alkalosis, HCO3 bicarbonate is increased more than 24 mmHg, hence it's called metabolic alkalosis. So here PCO3 is decreased, respiratory alkalosis. Here HCO3 increase, that is metabolic alkalosis. In case of metabolic alkalosis, our body will increase the PCO2. So our body will increase CO2 by hyperventilation, which is called a respiratory compensation. Again, I'm repeating, here our body will increase carbon dioxide by hyperventilation, which is called respiratory compensation. So we discussed the basic thing about acidosis and alkalosis. We will discuss some interpretations with some cases. You will understand easily. You can understand how we will manage this, how we will understand from a question coming from this topic. Case: if the pH is 7.3, PCO2 is 50 and HCO3 is 30. First, you know that the normal values are this. Here the scenario is pH is less, PCO2 is more, HCO3 is more. So what is your interpretation? If the PCO2 is more and HCO3 is more, yes, here is the case. PCO2 is increased in respiratory acidosis. Same case, the HCO3 also here increased. So here PCO2 is 50, it's more than 40 mmHg. HCO3 is also more than 24 mmHg, and pH is less, that's why it is acidosis. If pH is less, it is acidosis. So next we have to check PCO2 and HCO3. So PCO2 is increased and HCO3 also increased. That means it is respiratory. Simple. So we are moving to a next step or next interpretation. Here pH is less. So pH is less, it means yes, it is acidosis, and PCO2 is less or more. PCO2 normally is 40, here 30. So it is less or decreased. HCO3 the normal is 24, here only 15. So it is decreased. So PCO2 and HCO3 is decreased. We all know that this is an acidosis case because pH is less. So only we have to understand this is respiratory or metabolic, because we have to answer this, because here PCO2 and HCO3 is less. The case is, yes, it is metabolic acidosis. So moving to next scenario, here the pH is increased. So pH is increased, it is alkalosis, that you know. So we have to know, or we have to understand, in this case it is respiratory alkalosis or metabolic acidosis. Here PCO2 is 48, it is increased. Same like HCO3 also increased. So in case of alkalosis, PCO2 and HCO3 is increased in, yes, metabolic alkalosis case. So the third scenario is metabolic alkalosis. So moving to the fourth case, here the pH is 7.7. So pH is increased. So we know that pH is increased. Which one? Acidosis or alkalosis? Yes, this is alkalosis. And here the PCO2 is 32. It is decreased. HCO3 is also decreased 14. So both are decreased. So in alkalosis case, which respiratory or metabolic, the PCO2 and HCO3 is decreased? Yes, PCO2 here decreased, HCO3 is here decreased. So this is an respiratory alkalosis. Fine. You hope you all understand this, how you can interpret with questions and respiratory, metabolic, and alkalosis and acidosis. So in respiratory acidosis, which compensation is happening? Yes, it is renal compensation. And in metabolic acidosis, which compensation is happening? Respiratory. Here in metabolic alkalosis also respiratory compensation. In respiratory alkalosis, it is renal compensation. Here we go. So hope you all understand the ABG section. It's very easy. If you know the concept, it is very easy topic and you can easily crack the questions. So if you have any doubt in this topic or in this section, please just comment below. I will explain in the next class. So just read the topic, do the workout, do some questions, you will crack the exams. So if we are wind up this section, we'll teach you more, or we will discuss more in next sections. Thank you for watching.